Doctors, nurses, redditors, what has been your most gory, disgusting, or worst medical experience? Autopsy tech/death investigator. A morbidly obese man had died in a cheap motel room with the heat cranked up and wasn't found for several days. By the time we got him to the morgue, he was horribly bloated from decomp gas and was purple and green all over. There was lots of skin slip. Our forensic pathologist went to make the initial Y incision, and the force of the escaping gas blew gore all over us and the ceiling while making a sound like a wet balloon with the air being pinched out. We all paused for a moment, as the worst stank I have ever smelled enveloped the room, like something that had crawled out of Satan's anus. Then we burst out laughing because it was all we really could do. It didn't help that he was leaking liquefied fat all over the floor. That crap is slippery. My boots have never been the same since. As a paramedic, responded to a call of traffic accident, baby ejected. We prepared for the worst we could imagine. Arrive in about 8 minutes, trooper on scene trying to clear the area of bystanders/gawkers and preserve the scene. He had covered the baby with the yellow death sheet troopers carry in their trunks. Lifted the sheet to check vitals/pronounce death, and it was not a baby, but the top half of the 19-year-old girl that was driving the small pickup truck about 50 yards away. She was driving, and arguing with her 19-year-old husband who was the passenger. They were doing about 55 miles per hour on a 2-lane road, and met an oncoming truck pulling a double-wide mobile home. She ran under the front corner of the mobile home, cutting her in half. Her bottom half remained in the driver's seat, while her unhurt husband watched as the truck skidded another 50 to 60 yards, sideswiping a minivan, sending it into the ditch upside down. When the truck came to rest, her bottom half fell out onto the ground. We also found a trail of ribs from the cab to the bed, and down the pavement to the top half. It looked like a movie set. Her top and bottom looked unhurt, but from mid-chest to about pelvis was strung along the road. The husband was absolutely freaking out about what he had just seen. He was babbling incoherently, running around swinging at people, just a mess. A witness who lived right in front of the scene started having chest pains and had to be transported. We took the husband, and I called medical control and actually got orders to give him 4 Valium, something paramedics normally can only give for grand mal seizures. The driver of the big truck was fine, but was also very distraught at what he had just witnessed. That was 16 years ago and I can still remember pulling up to that scene like it was yesterday. OR nurse here. This is kind of a long one. I was taking call one night, and woke up at 2 in the morning for a general surgery call. Pretty vague, but at the time, I lived in a town that had large populations of young military guys and avid meth users, so late-night emergencies were common. Got to the hospital, where a few more details awaited me. Pararectal abscess. For the uninitiated, this means that somewhere in the immediate vicinity of the butthole, there was a pocket of pus that needed draining. Needless to say, our entire crew was less than thrilled. I went down to the emergency room to transport the patient, and the only thing the ER nurse said as she handed me the chart was, "Have fun with this one." Amongst healthcare professionals, vague statements like that are a bad sign. My patient was a 314 pounds Native American woman who barely fit on the stretcher I was transporting her on. She was rolling frantically side to side and moaning in pain, pulling at her clothes and muttering Hail Marys. I could barely get her name out of her after a few minutes of questioning, so after I confirmed her identity and what we were working on, I figured it was best just to get her to the anesthesiologist so we could knock her out and get this circus started. She continued her theatrics the entire 10-minute ride to the OR, nearly falling off the surgical table as we were trying to put her under anesthetic. We see patients like this a lot, though. Chronic drug abusers who don't handle pain well and who have used so many drugs that even increased levels of pain medication don't touch, simply because of high tolerance levels. It should be noted, tonight's surgical team was not exactly wet behind the ears. I'd been working in healthcare for several years already, mostly psych and medical settings. I've watched an 88-year-old man tear a 1-diameter catheter balloon out of his penis while screaming, "You'll never make me talk." I've been attacked by an HIV-positive neo-Nazi. I've seen some crap. The other nurse had been in the OR as a trauma specialist for over 10 years, the anesthesiologist had done residency at a level 1 trauma center, or as we call them, knife and gun club. The surgeon was ex-army, and averaged about 8 words and 2 facial expressions a week. None of us expected what was about to happen next. We got the lady off to sleep, put her into the stirrups, and I began washing off the rectal area. It was red and inflamed, a little bit of pus was seeping through, but it was all pretty standard. Her chart had noted that she'd been injecting 4 drugs through her perineum, so this was obviously an infection from dirty needles or bad drugs, but overall, it didn't seem to warrant her repeated cries of, "Oh Jesus, kill me now." The surgeon steps up with a scalpel, sinks just the tip in, and at the exact same moment, the patient had a muscle twitch in her diaphragm, and just like that, all hell broke loose. Unbeknownst to us, the infection had actually tunneled nearly a foot into her abdomen, creating a vast cavern full of pus, rotten tissue, and fecal matter that had seeped outside of her colon. This godforsaken mixture came rocketing out of that little incision like we were recreating the funeral scene from Jane Austen's Mafia. We all wore waterproof gowns, face masks, gloves, hats, the works. All of which were as helpful as rain boots against a fire hose. The bed was in the middle of the room, an easy 7 feet from the nearest wall, but by the time we were done, I was still finding bits of rotten flesh pasted against the back wall. As the surgeon continued to advance his blade, the torrent just continued. The patient kept seizing against the ventilator, not uncommon in surgery, and with every muscle contraction, she shot more of this brackish gray-brown fluid out onto the floor until, within minutes, it was seeping into our nurse's shoes. I was nearly 12 feet away, jaw dropped open within my surgical mask, watching the second nurse dry heaving and the surgeon standing on tiptoes to keep this stuff from soaking his socks any further. The smell hit them first. Oh God, I just threw up in my mask. The other nurse was out, she tore off her mask and sprinted out of the room, shoulders still heaving. Then it hit me, mouth still wide open, not able to believe the volume of fluid this woman's body contained. It was like getting a great big bite of the despair and apathy that permeated this woman's life. I couldn't effing breath. My lungs simply refused to pull any more of that stuff in. The anesthesiologist went down next, an XNCAAD1 tailback, his 6'2" frame shaking as he threw open the door to the OR suite in an attempt to get more air in, letting me glimpse the second nurse still throwing up in the sinks outside the door. Another geyser of pus splashed across the front of the surgeon. The YouTube clip of David at the dentist keeps playing in my head. Is this real life? In all operating rooms, everywhere in the world, regardless of socialized or privatized, secular or religious, big or small, there is one thing the same. Somewhere, there is a bottle of peppermint concentrate. Everyone in the department knows where it is, everyone knows what it is for, and everyone prays to their gods they never have to use it. In times like this, we rub it on the inside of our masks to keep the outside smells at bay long enough to finish the procedure and shower off. I sprinted to our central supply, ripping open the drawer where this vial of ambrosia was kept, and was greeted by an empty effing box. The bottle had been emptied and not replaced. Somewhere out there was a godless bastard who had used the last of the peppermint oil, and not replaced a single effing drop of it. To this day, if I figure out who it was, I'll kill them with my bare hands, but not before cramming their head up the colon of every last meth user I can find, just so we're even. I darted back into the room with the next best thing I can find. A vial of mastisol, which is an adhesive rub we use sometimes for bandaging. It's not as good as peppermint, but considering that over 1/3 of the floor was now thoroughly coated in what could easily be mistaken for a combination of bovine afterbirth and maple syrup, we were out of options. I started rubbing as much of the mastisol as I could get on the inside of my mask, just glad to be smelling anything except whatever slimy demon spawn we'd just cut out of this woman. The anesthesiologist grabbed the vial next, dousing the front of his mask in it so he could stand next to his machines long enough to make sure this woman didn't die on the table. It wasn't until later that we realized that mastisol can give you a mild high from huffing it like this, but in retrospect, that's probably what got us through. By this time, the smell had permeated out of our OR suite, and down the 40-foot hallway to the front desk, where the other nurse still sat, eyes bloodshot and watery, clenching her stomach desperately. Our suite looked like the underground river of ooze from Ghostbusters 2, except dirty. Oh so dirty. I stepped back into the OR suite, not wanting to leave the surgeon by himself in case he genuinely needed help. It was like one of those overly artistic representations of a zombie apocalypse you see on fan forums. Here's this one guy, in blue surgical garb, standing nearly ankle deep in lumps of dead tissue, fecal matter, and several liters of syrupy infection. He was performing surgery in the swamps of Dagobah, except the swamps had just come out of this woman's butt and there was no Yoda. He and I didn't say a word for the next 10 minutes as he scraped the inside of the abscess until all the dead tissue was out, the front of his gown a gruesome mixture of brown and red, his eyes squinted against the stinging vapors originating directly in front of him. I finished my required paperwork as quickly as I could, helped him stuff the recently vacated opening full of gauze, taped this woman's buttocks closed to hold the dressing for as long as possible, woke her up, and immediately shipped off to the recovery ward. Until then, I'd only heard of alcohol showers. Turns out 70% isopropyl alcohol is about the only thing that can even touch a scent like that once it's soaked into your skin. It takes 4 or 5 bottles to get really clean, but it's worth it. It's probably the only scenario I can honestly endorse drinking a little of it, too. As we left the locker room, the surgeon and I looked at each other, and he said the only negative sentence I heard him utter in 2.5 years of working together. That was bad. The next morning the entire department, a fairly large floor within the hospital, still smelled. The housekeepers told me later that it took them nearly an hour to suction up all of the fluid and debris left behind. The OR suite itself was closed off and quarantined for 2 more days just to let the smell finally clear out. I laugh now when I hear new recruits to healthcare talk about the worst thing they've seen. You ain't seen crap, kid. A child came to the hospital with cigarette burns dotting his torso. Almost every patch of skin that could be covered with a t-shirt was scarred. Some of the marks were old, some were very fresh. His parents said it was a skin condition. In my EMT class, an instructor was telling me about one of her calls to a freeway accident. There were 2 cars involved, and one of them had an elderly couple in it. Since she was so small, my instructor is often assigned the job of crawling through the windows of the car, to stabilize patients while the crew works on prying the doors open. She crawled into the back seat of the elderly couple's car and held manual C-spine for the woman, holding someone's head in place to prevent an injury by twisting the spinal cord. As she held the head, it came off in her hands. The woman had been decapitated by the accident. She had to take a couple of weeks off after that and talk to a therapist to help cope. I can't imagine what it must have been like to go through something like that. My sister's boyfriend is a nurse, and one day a very morbidly obese male was brought in because no one could figure what was causing his infections. Turns out his wife and him used to hide food in each other's rolls and the other would find it. His wife never found one of the cheese sandwiches he hid, and it got so moldy and it was there for so long that it actually fused to his skin. Edit. To all those who have read similar stories, he did actually tell me he witnessed this story. He might have been lying, but he does not seem like the type of person to do that. This is so horrible, I choose to believe you're lying. One of the most horrifying things I have ever seen in the hospital was a guy who OD'd on one of his prescription medications. One of the side effects was priapism, erection lasting more than 4 hours. Once the doctors got his cardiac and respiratory systems relatively stable, they tried to get rid of this poor dude's erection, which was starting to turn purple/black/blue. After several non-invasive methods, they did what they had to do. They had to inject drugs directly into the head of his penis. Not 1 shot. Not 2, or 3, or 4. 19 injections into the head of his penis. It was still swollen, bruised and red 2 weeks later. I did not witness this firsthand, but the most disgusting medical-related story I've heard from a practitioner who actually lived to tell the tale. As part of my training to be a rape crisis counselor, a doctor came in to give a presentation about STDs and STIs. Somehow he veered off the main topic and starts telling us about the things he's seen in his time. A female patient came in complaining of extreme abdominal pains. The patient disclosed that she was a prostitute. The patient further disclosed that in order to continue working while she was on her period, she would put a sponge as close to her cervix as possible to absorb the blood and other menstrual-related discharge. The patient then explained that she had inserted a sponge and was unable to remove it. The doctor figured it would be a routine matter of removing a foreign object that had become lodged or stuck and takes the patient into an exam room to perform the extraction. When the doctor went to remove the sponge, it turns out that the patient had been using a car washing sponge to absorb her menstrual discharge, and that the same sponge had been in her vagina for 3 months. When the doctor finally managed to remove the car sponge, which had turned into black, semi-solidified mass due to excess absorption of nastiness. It also released a torrent of fluids that had been marinating in this woman's vagina for 3 months, and the fluids gushed out and nearly covered the entire floor of the exam room. The doctor told us that it was the first time in his 20-plus years of practice that he actually vomited while performing a medical procedure, and that the stench from that room was so foul and pungent that it filled the entire clinic and made a seasoned nurse, who was standing in the hallway, vomit. As the doctor was retelling this horrifying life tragedy that he survived, he didn't look a single person in the eye. His eyes were transfixed on some non-existent point near the horizon of his traumatized memory. I was assisting in a crash C-section once. The mother was eclamptic, sky-high blood pressure, and the only cure is to deliver the baby. But she was only 25 weeks. It was so fast that there was no time to get an epidural, so we had to put her under general anesthesia. The baby had a strong and healthy heartbeat, but of course, once you deliver at 25 weeks, that doesn't matter. The father sat in recovery, beside his wife's stretcher, holding their dying baby. The whole time, tears and tears just running down his face. He never said anything. He just sat, without talking, holding a tiny bundle of blankets, looking down at a perfectly formed tiny face struggling to breathe. The mother was still sedated, but when I walked in, the father had the bundle in one arm, and was holding the hand of the mother with his other hand. He was humming a lullaby. He just held and held the baby until he died in his arms. Never saying a word. Just rocking it back and forth, humming to him. Crying the whole time. I saw a man just after he was burned in a boiler explosion. His skin hung in strips off of his body, as if it had slipped off, like how easily the skin of a tomato slips off after it is boiled. Underneath was glistening pink/red flesh. The room smelled of cooked flesh and mechanical grease. The poor man was aware and moaned/screamed in pain. It was terrible. Stories from Dr. Friends. 1. Guy was scratching his hemorrhoids with a 50mm bullet and it got stuck up there. Since it was a live round, the bomb squad was called and held their blast shields or whatever around the patient's butt as it was removed. 2. Couple wanted to make perfect/custom dildo for guy's butt, so they put a condom in and fill the condom with cement. Condom breaks and almost a foot of his intestines has to be removed. My mom is a nurse in the ICU. One day, she got an elderly patient that was in terrible condition. The woman's toe was literally rotting off while still attached to her foot, and most of her body was covered in dried poo. In some places, the poo was literally inches thick. She was also half-starved and had bed sores from not moving. The most horrifying part is that this old woman had been living with her own son the entire time. She'd fallen down in their kitchen, and he had just left her there.